Sometimes after class, not really during, but after, I will have kind of this weird sort of pulling sensation here. Yeah, it feels
kind
a
of
little
up
bit,
the inner forearm there.
yeah, it feels a little bit like spicy.
Okay. And nothing at the outer hand, like this more fatty. No. And then the wrist on this side.
It's not as bad as
Not
the
as bad.
left side.
Okay. All right. Nice. The same, really slight difference. And you flip both of your hands over for me. All the way down, anything there? No? And then we'll do the side to side motion.
Just that same sort of
On the outer.
yeah.
Do you feel it on your joint here?
T. B.
And here in the center, any of that tingling as I come around. And here.
Just the slightest bit. Yeah, then I get it there.
All right. Hello, Miss Hannah.
Hello.
How are you feeling today?
Pretty good.
Good. Thank you for coming into the office. I actually have you in for a specialty visit today, so we're doing a bit of a hand exam. Okay. So from what I'm reading, it looks like we're having some new symptoms. Nothing really emergent, but you said you have been noticing just a little bit of like pain and swelling.
Yeah, so I started getting into yoga about 6 weeks ago, and I'm going 4 or 5 times a week, and I have noticed that I've been getting kind of an unusual amount of discomfort and pain in the joints of my hands, more on the left side than the right. But you know, my other joints feel okay, so it feels very specific to my hands themselves.
So more so on the left side.
Yeah, a little bit more
Are
here.
you left or right-handed?
I'm right-handed.
Okay. And the yoga that you're doing, is it very like stretch focused? Are you doing anything positional with your hands where you're like putting more weight on your hands than normal?
It's pretty active yoga. It's like a group flow class, so I do a lot of planks and down dogs and lunges and things like that. So my hands are down like this quite a bit.
Okay. And this is, I know that you were fairly active before, but yoga isn't something you were incorporating as much, so maybe could be an overuse or could be...
Yeah, I've done yoga in the past frequently, but I had taken a long break.
Okay. Any injuries recently during or not during yoga? Did you like fall and land on your hands or anything like that?
Not that I can recall.
No. And no past issues with circulation or anything like that?
Yeah, you know, kind of cold, little tingles in the winter time, but it's not usually an issue during yoga because it's warm in there.
Okay. And I'll check that right side as well. And as far as the pain, like where exactly is it? Can you tell me where
it's really in the knuckles and then a little bit in these joints as well. Okay. I do feel it on the right side, but it's not as bad.
Okay, so kind of first and second joint there. Is there any part of the hand that's worse than the other as far as like thumb versus fingers? Or?
The fingers are worse than the thumb. Yeah.
Okay. And does that radiate at all up the wrist or to the elbow? Is it affecting your like upper arm area?
Sometimes after class, not really during, but after, I will have kind of this weird sort of pulling sensation here. Yeah, it feels
kind
a
of
little
up
bit,
the inner forearm there.
Yeah, it feels a little bit like spicy.
Okay. So we're dealing with some issues with like muscle tightness in there, so okay. All right, so I'm going to do a couple different things. Obviously going to do, you know, a bit of a visual inspection, kind of have a look and see if there's anything externally that I think is very concerning. What would you say like the pain is at this moment?
At this moment, it's not too bad. It's like a 2-3, just kind of a dull ache.
So kind of mild. And you said it's dull achy. So do you ever get any like sharp shooting pain? Any like really strong, just like stabbing?
It's definitely a little sharper when it's bad, right after class or a couple hours after class.
Okay.
And it feels like tighter to open and close my hands. It feels a little bit tight.
So then we might be definitely dealing with some inflammation there. Okay. Just pertaining to the tightness, any changes to your diet recently? I know that kind of seems unrelated, but if you're increasing like your salt intake, then it can definitely. So nothing there either.
If anything, I've decreased my sugar intake a little bit.
Okay. All right. Okay. Any other thing that you think is notable that I should take into consideration?
None of my other joints are hurt.
Everything's just your hands. Yeah. Okay. All right. So let's go ahead and start with our initial inspection here. So I want to have a look firstly, obviously, to see if there's anything that I think is, particularly concerning. So I'm actually going to start on the hand that you said it's not that bad and see. So my hands are fairly cold, so your hands do feel warm, which is a good sign. Don't see anything at the top of the hand, nothing that looks. So oftentimes if there is inflammation, you can see it externally in the joint, but don't notice that here. If I could just have you flip this hand over for me. Does anything hurt as I'm kind of feeling around?
Felt a little sore right on the thumb area muscle, like that.
Like lower down here?
Mm-hmm.
Okay. So this is a place for sure where you're putting a lot of downward weight during yoga, because that muscle is kind of what's holding your hand in place there. So that kind of makes sense. Any pain in the other fingers? No. Okay, that's fine. Flip your hand over for me. Mostly looking for like inflammation, which is not notable. I can still see your veins. I can still see the color, which is good. So sometimes if there's excess fluid in there, then I won't, so much be able to see the visualization there. That's good. Same pain on this side thumb or not so much?
Doesn't feel as bad.
No.
For some reason. It felt worse like in this area.
On this side?
Yeah.
Okay. All right. So I'm going to go finger by finger here. If I palpate here over each of the joints, any pain there?
Okay.
And this one here?
Yeah, that feels kind of sore.
Sore? The whole finger or just kind of this first?
Just there.
Okay. And the middle finger?
The middle joint's worse.
Middle joint? Okay. And then here?
Middle joint, right when you get there, it feels tender.
So far, kind of upward here. And then the pinky at all?
Pinky's not that bad.
Okay. Any pain up the wrist at all?
When you bent these ones backwards, I kind of felt that
a strain there. Okay, so you can see here, just not to overextend, but you have a very thin kind of ligament that runs up your arm here, and that's what kind of controls the muscles of the hand. So that does kind of make sense. And if we do the same here, so I know you said obviously there is tender. Going up the thumb, does that hurt at all?
A little bit.
And then if we do here.
Yeah, it's this joint.
Okay, and then here.
Same thing, middle joint.
Anything at the pinky here?
No.
And nothing at the outer hand, like this more fatty? No. And then the wrist on this side?
It's not as bad as the left side.
Okay. All right. Okay. So we're just gonna look at the upper arm here. Sometimes if we're lacking in strength at the shoulder, then we can kind of be overcompensating with hand grip strength for sure. So just having a look there. I don't notice any like asymmetry or anything with the upper body. You have very good muscle tone. I'm just gonna reach back here. So these are like freezing cold, so yeah, I'm sorry about that.
It's really warm, so that's nice.
The natural form of the arm that's considered normal, so just Now you extend both hands as wide as you can, fingers all the way out for me. Have you found that your mobility in your hands is lacking at all? Any issues with being able to, you know, grab things or grasp onto things? Any issues with your grip strength?
I'm very slidey on the mat.
Okay.
I have noticed that I'm having a little trouble staying. I really like grabbing.
Okay. So you're really trying to like hold space there.
But not like using silverware or brushing my hair or anything like that.
Alright. It's a very similar tool here. This one's just a little more malleable. So I'm going to measure this like fatty portion of your hand here in between the index finger and the thumb. Nice. The same, really slight difference. Have you flip both your hands over for me? More there, 15. This I can already tell doesn't have quite as much. Yeah. 11 there. Okay. Okay, so this side definitely is just a little bit more swollen. It's not like, you know, notable visually, but when I do measure, I can tell just a little bit. So I'm just gonna write that down. Okay. All right, so I'm gonna have you do a couple things for me now. I'm gonna kind of just hold you in place here. I want you to move your hand up like this, and then all the way down as far as you can. Any pain there?
Yeah, I'm on an extension here.
It does. It hurts down at the wrist.
Yeah.
Okay. And then if you move just side to side, anything there? Or a little bit of a click there?
Yeah, a little bit here.
Okay. All right. And if you just extend your fingers, stretch as far as you can, do you feel a strain there at all?
I kind of feel it like in the knuckles. Like anytime they start to go up, it feels like pressure.
And if you like squeeze a really tight grasp, anything there?
No. That one's okay.
Do the same thing on this side. So I'm going to hold you here. Go ahead and go all the way up. Anything
there? Not as bad, no. It's just like a little bit.
Okay.
Feels like a stretch.
All the way down. Anything there? No? And then we'll do the side to side motion.
Just that same sort of
on the outer here. And then if we stretch wide, same kind of discomfort there.
Yeah, definitely. More just these ones.
Okay. Yeah. And then if you make a fist for me.
Oh, that's okay.
That's okay. All right. So as a whole, you would say this side still just feels a little bit more intense.
Yeah.
Okay. All right. So I'm gonna have a look at your veins here. Stretching the skin just so I can see. So looking for any occlusions, I can see your vein here, nice and clear. So just looking to see if there's any areas that kind of disappear. That looks okay. I don't feel any nodules. Slightly more prominent veins on this side, so that could also indicate more swelling here just because they're not as protruding, versus this side I can see them a little bit easier. No history of anemia, right?
No.
Looks good. Right. Just gonna do a little. Those look good. Capillary refill is normal. Got very good blood flow of the hands. I don't see like that's definitely not an issue. I don't think this is like a circulatory problem. I do see some swelling on this other side. Veins all look really good, and your joints are very palpable. There's nothing, you know, irregularly mobile there, which is a good sign. All right, I'll have you flip over for me and look at the veins at the wrist here. a little better on this side. You can see it's about the same visualization as it is on that side, so that's good. Again, there's been a sense of occlusion there. I do feel just a little bit of tightness here when I push it down.
It feels
like
tighter,
that.
yeah.
It's a little bit tighter than I'd like to see. There's not quite as much mobility there. It does feel like it's straining just a little bit. Not quite as much on that side for sure. Yeah. So if you picture like a literal rubber band, if it was cut and then kind of stretched the length of your arm, should be fairly malleable. When you push it, you can kind of feel it stretch and extend. I do feel that here, but I feel that it's just a little bit tight, and then you're feeling the tenderness, so that does make sense there. So I'm going to check your pulses and see. Okay, I do feel it. Heart rate and rhythm is normal. There's no signs of occlusion. I will say it's not like overly prominent, but I do feel it there, so that's good. Much stronger at the wrist. It's not always palpable here. Okay. I'm just going to check this. It's actually slightly stronger on this side. Very even symmetrically, which is a good sign. Nice and strong on both wrists. That's very, very good. Okay. All right, Hannah. So let's test a little bit of strength comparatively. So I want to test both sides at the same time and see if there's any difference from one side or the other. So I'm going to have you start by holding your hands kind of up like this. I'm going to attempt to push them down towards the table. I'd like you to not allow me to do that. Okay, so let's do opposite here. I'm going to push up. Much better. Okay. And if you stretch your hands out for me, I know that's a little uncomfortable. Are you able to feel the difference there?
Yeah. Okay. It feels harder.
Okay. Now have you hold your arms up like this as well. Much better there. And push out. Okay. All right. So that's good. So your forearm strength is definitely intact, so we can say that it's for sure isolated to your hands. Okay. All right, let's do... I'm going to start first by just testing for some temperature variation from side to side here. So if I do inner elbow. Listen, there's notable variation from one side to the other, which is interesting. Okay. And you flip your hands over for me just briefly. About the same. So it's not, terribly concerning. Neither side was febrile, but there was a little bit of a difference here. So slightly cooler in the forearm on this side, but slightly warmer in the palm. So again, just kind of leans towards that inflammatory response. So I'm going to do a bit of a stethoscope assessment. Now this is just auscultation, so it's going to allow me to listen to blood flow, any issues with your circulation. It kind of just gives me better than obviously what I can hear on my own. So. Again, it's a little cold, so I'm just gonna have you just breathe normally for me. Abnormal breaths can affect your circulation, so just try to relax a little bit. Take this hand here. Look at this. Okay, go ahead and relax. If it's all right with you, I'm going to place this up at your carotid artery on this side. I just want to hear. I am noticing this maybe a little bit of occlusion with the wrist. Okay, all right, you can relax. Okay, so I'm going to take a bit of a mental note here. I don't want to forget. Okay. All right, so moving forward, I'm going to focus just a bit more on this side because I do see a little bit more issue here. So go ahead and do what's comfortable for you there. I'm just going to palpate down here first. Do a test for bone conduction here. So 1, 2 before I alter your reflex perception. Do you feel vibration here? That should feel vibrating. You feel that here as well?
Yes.
And here?
Yes.
Do you feel it on your
Yes.
joint here?
Yes.
Do any of these not feel like vibration?
No, they all feel like vibration.
All right, that's good. All right, so I am going to just test at the wrist here because I am concerned that this might be altered. So just give me all of your weight kind of here in your elbow. Good. Okay, so right there. Let me just start your hand up here. I hand you something here. I hand this to you and just have you kind of hold it. Don't let me pull that out of your hand. Okay, that's good. So I was feeling a little bit of weakening at the index finger there, but that feels okay. Just turn your hand. Would you say that this point here is tender?
It's more the middle.
Okay.
But yeah, that doesn't feel 100% right.
But here is definitely
that-
where it hurts
that
the most.
Hurts the most, and it kind of like feels
Comes
goes down and up.
here.
Yeah.
Okay, so I can definitely feel some tension there as I press down. I feel this kind of pulling here in your hand.
Yeah.
frequently are you doing yoga? How many times a week?
4 to 5 times for an hour at a time.
So I'm thinking this is like an overuse issue as well. So you've got some kind of rigidity here just from like overcompensation because it is like newer that you're putting weight on these muscles. I think maybe you could just be doing.
This is my weaker arm,
Yeah.
so I might not be distributing very well. I wonder.
As soon as I push down here, I
I
feel pulling.
Mhm.
Yeah. So essentially when you're going, let's say you're doing, positional hands down on the mat, as soon as you start to put weight on, it's pulling like from the elbow all the way down, and that's why you're getting that tension there. My concern is that with continued overuse, we can actually snap that tendon that you have in there. So I'm not saying that, that we would have to do like an MRI and really get a good look in there, but it is something just to kind of keep in mind. You don't want to continue to overwork it without giving it proper rest.
Mm-hmm.
So at the very minimum, I would suggest doing yoga every other day, just so you're having kind of a period in between where you're giving yourself a little bit of rest. Okay. So I'm going to do a couple things here. I've got a pencil I'm going to draw on your hand. Not obviously really, but I want you to try to tell me what you feel me drawing. And I'm going to test both sides. I'm actually going to start with this side. So you should feel a capital letter here.
A B.
Good.
An X. An N. Okay. W.
And on this side.
W.
Good.
T. B. L. Or 7.
That's okay. All right. So keep your eyes closed for me. I'm going to hand you a couple different things here, and I want you to tell me if you feel any textural differences. So these 3 objects are all very similar in shape and size. So you can try to tell me what this is made out of as far as material.
Wood.
Good. And here.
Plastic.
Good. And here.
Probably still plastic.
And here.
Wood.
And the last one there.
Metal.
Very good. Okay. Good job. So that was plastic. Very good job. I'm going to do some nerve testing here. I'm going to start with the pencil. I'm going to trace very softly. So this is going to act as our kind of softer sensory stimuli. I want you to indicate to me when you feel it. So you can either just say yes or nod your head, whatever you're more comfortable with. I'm going to switch tools here. Now this one is quite distinctly sharp. You feel that that's sharper? Okay. Same thing, just nod if you feel it. Did any of those feel not quite as sharp, or all about the same?
All the same.
Okay. Now this one is similar but different in that it's a little bit larger. You can keep your eyes open for this if you'd like. I'm going to do alternating sides and then down the length of your arm, and I really am testing this time to see if it feels different on either side. So what we're looking for is any sort of like nerve damage or lack of sensory stimulation here. So if we do up arm here, up, feel that same?
Mm-hmm.
Test different dermatomes here, so there and there, so that feels the same.
It's the same. I get like a little tingling once you get all the way down
Tingling?
here.
Okay.
I get like kind of like up here.
Radiates up the finger.
Like this.
Okay. All right. And not on that side. Okay. And we go right down the middle here.
Yeah, the same thing.
Same
I
thing.
feel like kind of like hot in those fingers, but not super severe or anything.
Okay.
But it feels kind of funny. That's fine too.
That's fine. Okay. So that's good to know. And if we do, we can relax that one for now. So outer was fine. So if we do like this, any of that sensation there? And here in the center, any of that tingling as I come around, and here.
Just the slightest bit. Yeah, then I get it there.
All right. Okay, so these first two fingers are definitely the most affected here. And are you able to reach with your pinky and your thumb there? Does that cause you any discomfort?
Yeah, a little bit.
A little bit?
Mhm.
Okay. Okay. Just here. Okay. All right. So you can go ahead and relax. I think that's enough of the like physical examination for today. So I do think that what's happening overall is just you've got like an overuse of the ligament in your hand. So like I said, I would recommend kind of moving to, you said 4 to 5 days a week, which is okay for physical activity. Obviously, I don't want to discourage you from, you know, moving around and doing what makes you feel good. I do just want to be careful. So you can maybe consider some modified yoga. You also said that this is your weaker hand.
Mhm.
So you might want to consider adding on some strength training if that's not already something that you incorporate on a daily basis, even if it's just the very light, you know, 1 to 2 pound weights, just to kind of get the strength up a little bit here in both your hand and your wrist. So you've got decent, you know, muscle tone on your upper body here, but obviously we don't just quite work on our grip strength as much just because we don't typically need to. But if you're doing body weight mechanics, which yoga tends to be very body weight heavy, that is something that you want to consider. So I would say let's try to switch to every other day, if nothing else. I'm gonna say if you take some modifications, if you start adding in a little bit of strength training in about another month, if it's still causing you pain at that point, even if it's steady, definitely if it gets worse, I would like to have you in, and then I think at that point we should probably do some imaging to make sure that there's not anything like internally, structurally that could be damaged.
Okay.
For now, I think it really just is kind of a rest and don't overuse situation.
All right.
Okay.
Thank you.
All right. So maybe some heat compresses and just give it a little bit of a break.
That's right.
Thank you so